How to treat it is Dr. Chad Damang, a North Shore neurologist and pain management expert with the Avila Physician Network. Thanks for joining us.
Good afternoon. Always my pleasure.
Okay, so what causes vertigo?
So vertigo is very common. The first thing I want to make sure for our viewers is to separate vertigo from syncope. Vertigo, as you said, is the sensation of movement, whereas syncope is like the shades coming down, right? So you're feeling like you're going to pass out. From a neurologic perspective, it's a very complex structures that does our ability to feel where we're at and to know our position. So the inner ear has several chambers, the saccula, the utricle, the semicircular canals, filled with a fluid called endolymph that tells us the movement. All these structures talk to a nerve called the vestibular cochlear nerve, then interacts with our brain, our eyes, our nerves, our cerebellum. So all these structures together allow us to know where we're at. Any abnormalities, we think we're moving when we're not.
So here's a question, because so many people suffer from this sinus infections. How do you know you're not dealing with something from a sinus infection versus vertigo?
Yeah, so the first thing when I sit with a patient as a neurologist, I separate peripheral from central vertigo. So peripheral vertigo means something's wrong with the inner ear structures, right? So many ears disease, too much fluid, an infection, benign positional vertigo. So the crystals are moving around so you feel it. Peripheral vertigo patients is when they move, they get it. If they're sitting still, they have no problems. Central vertigo implies a problem with the central nervous system, your brainstem, stroke, blood vessel abnormalities, migraines. Those patients have sensation of movement even when they're sitting still. So it's important to differentiate the two. You can do MRIs. You can do what we call Dick-Hallpike maneuvers to see if you can replicate the symptoms. You can do hearing testing. So this is where a neurologist and a vestibular balance ear, nose, and throat doctor have to kind of figure out what part of that system is causing those symptoms of vertigo.
Yeah, some good advice there. So what are the treatments for this?
So when you're talking central vertigo, the biggest thing is what's causing it. Do you have a tumor? Do you have a blood vessel abnormality? Is there something that needs to be cut out? If you have an infection, obviously you treat it. If you can't find what's wrong, then you just come to medications. A lot of migraine medications can be helpful. Benzodiazepines, Valium, Xanax can be helpful. The antihistamines are not so great when it comes to central vertigo. Peripheral vertigo, you can do Epley maneuvers, so you can relodge those crystals in your inner ear. You can do antihistamines, antivert. There are some vestibular balance clinics that will help you learn how to adjust to it. But the bottom line is you want to find what is the underlying problem. Is there a structural abnormality that needs to be surgically corrected? You just don't want to be taking medicine to fight a symptom when you don't know what's causing it.
Yeah, because it's not normal to feel off balance and to feel motion
That's
spinning.
correct.
So some good advice, get to a neurologist like yourself or get doctors to check it out, or also find you online if you've got more questions, right? At Dr. Chad.
Absolutely. Dr. Chad, Facebook, Instagram, always around.
Okay, thank you so much, Dr. Chad. Appreciate it.
Well, Liz, let me know if you see anything moving. You may have vertigo yourself, so let me know.
Got it. Okay, thanks.